Good evening, everyone. Am I audible? Am I audible? Okay, so let's start with the first MCQ. So let's start with the first MCQ. Which permanent tooth begins its calcification at or around the time of birth? You see, in NEET MDS, some questions may be regarding the calcification duration, calcification timing, right? So chronology is important. It is one of the important topics. So based on chronology, when does the calcification of the tooth begin at around the birth? So which tooth begins calcification around the birth? Right, primaries, they all begin before birth, but there is only one permanent tooth which begins its calcification at the time of birth. And which tooth is that? Maxillary central incisor, canine, first molar or lateral incisor. So obviously it is the first molar which begins its calcification at the birth, be it maxillary or mandibular. So here we have written maxillary, but otherwise had it been mandibular, even that would have been correct answer. So at birth, the tooth that starts calcification is first permanent molar, isn't it? In the first year, yes, very good, Nikesh. Yes, everyone is correct. Option C, right? So in the first year, which tooth starts calcification? Which teeth will start calcification? All the anteriors, isn't it? All the anteriors, they will start calcifying in the first year of the life, and the last tooth to calcify in the first year of life is the maxillary lateral incisor. So that's how you can remember some teeth that they will start calcifying in the first year, some teeth will start calcifying in the second year, yet some others will start calcifying in the third year. So the earliest permanent tooth to start calcifying or to initiate is the maxillary and mandibular first molar, right? All of the following teeth typically erupt by 10 years of age, except. So again, another question from chronology. Mandibular canine, maxillary lateral incisor, mandibular first molar and maxillary canines. So three of these are anteriors and one is a posterior tooth. So obviously, which is the first tooth to erupt? Again, when you look at chronology, when you look at the eruption dates, the first molars, right? The first molars, they are the first to erupt. And the first molars, they will erupt at an age of around, when will they erupt? They will erupt at an age of around 6 years, isn't it? They will erupt at the age of around 6 years. So they are the first permanent tooth to erupt usually. After that, the mandibular central incisors will erupt at the age of around 6 years, isn't it? 6 to 7 years. Then the maxillary central incisors, mandibular canines will erupt at an age of around 9 to 10 years. Yes, very good everyone. D is the correct answer, isn't it? So the last tooth to erupt would be maxillary canine and it would erupt at an age of around 11 to 12 years. So this is the correct answer, right? So please be thorough with your chronology. Yes, very good couple. The correct answer is option D. Which tooth is the longest in the permanent human dentition? So another topic that may be of importance is the dimensions. So mesodistal dimension or buccolingual dimension or the crown length or the root length or the entire length of the tooth. So which tooth is the longest in permanent human dentition? So here this tooth does not, this word does not matter, isn't it? So permanent likha ho chahe nahi likha ho, which tooth is the longest in human dentition? Again, the answer would be same, isn't it? Maxillary central incisor, maxillary canine, mandibular canine, and maxillary first molar. So, which tooth do you think has the maximum inciso-apical length or has the maximum length? Three ka, yes. Option B is the correct answer, not the D, right? It is the B which is the correct answer. See, its crown is approximately 10 millimeters and its root is approximately 17 millimeters. Whereas mandibular canine has a crown length of approximately 11 millimeters and root length of approximately 16 millimeters. So overall, though it might appear that both of these have a length of approximately 27 millimeters, but the maxillary canine is still slightly longer than the mandibular canine. So that difference is in decimals, and that's why we have ignored it, right? Yet it is the longest tooth. So when you are asked which is the longest crown, so crown, which is the longest crown, then obviously mandibular canine is the longest crown. It has a length of approximately 11 millimeters, isn't it? And in maxilla, the longest crown would be maxillary central incisor. This is the longest crown in maxillary arch, and it has a crown length of approximately 10.5 millimeters, right? So here the correct answer is option B, that is maxillary canine. Is it clear? So next question, which permanent tooth has a mesial cusp ridge that is longer than its distal cusp ridge? So mesial cusp ridge is longer than the distal cusp ridge. So usually what is the rule? The rule says that the distal cusp ridge is always longer than the mesial cusp ridge. But then there are two exceptions. There are two exceptions to this rule, isn't it? And what are those exceptions? These exceptions are maxillary deciduous canine and first premolar, isn't it? Maxillary deciduous canine and maxillary first premolar. So these are the two exceptions of this rule. And what are the options? Maxillary first premolar, maxillary second premolar, maxillary canine, and mandibular first premolar. Right? Now here the definite answer would be maxillary first premolar, because this maxillary canine, it is not mentioned whether it is primary or permanent. So when it is not mentioned, we would usually consider it as permanent, right? So when permanent or primary is not mentioned, we would usually consider it as permanent. Though here in the question we have this word, permanent tooth, right? So option A, that is maxillary first premolar, is the correct answer. Achha, one more thing you should remember, whenever a picture based question is asked, the tooth would always be in the orientation that it is seen in the oral cavity. So if it is a mandibular tooth, the crown would always face upwards and root would face downwards. And if it is a maxillary tooth, then the crown would always face downwards, isn't it? So that is the first thing you would notice. The orientation of the tooth to decide the arch, whether it is maxillary or mandibular. You won't go looking for the features on the crown or on the root to decide whether it is a maxillary or a mandibular tooth, right? You have to see its orientation, and that orientation would decide whether it is a maxillary or a mandibular tooth. Is it clear? So if suppose in the exam such a picture is given, suppose in the exam such a picture is given, right? There is a three-rooted molar and its crown is facing upwards, roots is facing downwards. Would you call it a maxillary molar or a mandibular molar with a bifurcated distal root or mesial root, or whichever root it is? What would you call such a crown? What would you call such a tooth? A maxillary molar or a mandibular molar? The first thing that we have to look at is its orientation, isn't it? It is definitely a mandibular molar, and here we can see a bifurcated root. Right, so mandibular molar with a bifurcated root. Is it clear? So it doesn't matter whether it has a three roots or two roots. If the crown is facing upwards, it is definitely a mandibular tooth. So next question, the cusp of Carabelli or the Carabelli's tubercle is typically located on the, so where is Carabelli, cusp of Carabelli found? Now see, there are different types of cusps, primary cusps, secondary cusps, isn't it, accessory cusp, and this cusp of Carabelli, it is classified as a tubercle or sometimes even as an accessory cusp. So accessory cusp or tubercle, sometimes these are used as interchangeable terms, isn't it? So which are the primary cusps? In the maxillary molars, apart from the distal lingual, all are the primary cusps. In the mandibular molar, apart from the distal, all are primary cusps. So distal lingual of upper molars and distal cusp, these are primary, secondary cusps, all other are primary cusps. Tubercles or accessory cusp like Talon's cusp, Densi vaginatus, cusp of Carabelli, these are all tubercles, right? So, as you have all said, option A, that is mesiolingual aspect of the maxillary first molar. That is the correct answer of this question. Very good. So, it is found on the mesiolingual cusp, isn't it? It is found on the mesiolingual cusp. So, can you tell me one other additional feature, unique feature associated with this cusp? So, when we talk about mesiolingual cusp, there is a unique feature as related to embrasures. So, what is that unique feature? So, usually what happens is the buccal embrasure is smaller than the lingual embrasure, right? Buccal embrasure is smaller than the lingual embrasure in all the tooth, in all the teeth, the buccal embrasure is smaller. How to identify occlusal view? That is mesial distal if possible. Sure. See, usually it is very easy. In anteriors, let me first complete this, right? So, buccal embrasure is usually smaller than lingual embrasure, but because the mesiolingual cusp is a bit larger, right? And it also has cusp of Carabelli. Because of that, the lingual embrasure is usually smaller than the buccal embrasure. So someone asked me to explain the occlusal view and then deleted the comment. I don't know who the student was, but okay, it's usually quite easy. So let's say if it's a posterior tooth, if it's a molar, right, then molars, what would happen? Now usually they won't ask you about those teeth which are confusing. राइट, तो कंफ्यूजिंग टूथ के बारे में वो कभी नहीं पूछेंगे आपसे, वो आपसे यूजुअली पूछेंगे वो टीथ जो कि इजी हैं. सो let's take an example of a confusing tooth. Let's say it's mandibular second molar instead, right? Let's say it's mandibular second molar. Mandibular second molar usually is confusing. Why? Because it's usually symmetrical, right? It appears symmetrical. So what would you focus on? We know that there is a difference in the size of the cusps, isn't it? We know that there is a difference in the size of the cusps. So which is the largest cusp? Usually it is the mesiobuccal. That is the largest, right? Mesiobuccal, let's say this is the mesiobuccal cusp. It is the largest cusp. So mesiobuccal. So this is usually how it will go, isn't it? So take a look at the tooth and decide where you can see the contrast between the cusps, right? The contrast, that is difference in the size of the cusps, is maximum. So let's say if this cusp appears exceptionally large and this cusp appears smaller than rest of the cusps, then what it says is that obviously this is the buccal side and the largest cusp is the mesiobuccal cusp and the smallest cusp is the distobuccal cusp. Is it clear? So that's how you can differentiate between the mesial and distal sides and the buccal and lingual sides. Similarly, for maxillary it becomes quite easy because there you will have the oblique ridge, isn't it? And in case of first molars, it obviously is very easy because you have the distal cusp in the mandibular molars, which makes it easy to recognize. In maxillary, we have cusp of Carabelli and the oblique ridge. So oblique ridge obviously is directed from distobuccal to mesiolingual, and again mesiolingual is the largest cusp in maxillary molars. So that can help you differentiate between mesial, distal, buccal and lingual. Is it clear? Now when you take a look at the anteriors, so let's first go to the premolars. So usually they would ask you about the first premolar and not the second premolar, because second premolar often is confusing, at least the maxillary second premolar. So what happens in the maxillary first premolar? You will always notice the mesial marginal groove. So mesial marginal groove will help you decide which is the mesial and which is the distal side. So wherever the groove is present, that is the mesial, other side is the distal. And where you see a larger or prominent cusp, that would be buccal, and the other one would be lingual. Is it clear? Similarly, in mandibular we again have a unique groove, which is the mesiolingual groove, that can again help you differentiate which is the mesial side and which is the distal side. And lingual is easy to identify because the cusp is almost non-functional. So that would be lingual. Wherever you see a functional cusp, that is buccal. Mandibular second molar, if at all they are asking you, it would usually be a 3 cusp variant, and in the 3 cusp variant, the cusp that looks larger on the lingual side, that would be your mesiolingual cusp. So again, that can help you identify the mesial and distal sides, right? So that's how you can identify, basically differentiate between the features. For incisors or canines, again you can take a look at their curvature, so that their curvature of the incisal ridge can help you differentiate, right? So wherever the ridge is converging or wherever the ridge is bending, that is the distal side. In normal angles class 1 occlusion, the mesiobuccal cusp of maxillary first molar occludes in the. So as we have seen in the class during occlusion, occlusal contacts, there are 2 types of cusps, right? A supporting cusp and a guiding cusp. So where does the supporting cusp occlude and where does the guiding cusp occlude? So obviously the supporting cusp occludes in the central fossa and marginal ridges, whereas the guiding cusp, it occludes with the grooves and embrasures. So mesiobuccal cusp of maxillary first molar, first of all, whether it is supporting or guiding, it is guiding cusp, isn't it? So it will occlude either with the groove or embrasure. So central fossa of the mandibular first molar says couple, but couple, the thing is mesiobuccal cusp maxillary first molar, that is a guiding cusp, not a supporting cusp. So guiding cusps cannot occlude in central fossas. Clear? So that's why I asked you to first identify whether it is a supporting cusp or a guiding cusp. Second is buccal groove of the mandibular first molar, that is mesiobuccal groove, and this is the correct answer, right? This is the correct answer here. So yes, option B is the correct answer. Distobuccal groove, again this is wrong. Embrasures between the mandibular first and second premolar, again it is wrong. So that's our first identify whether it is a supporting cusp or a guiding cusp, and then you can make that picket fence diagram that can help you that can help you easily identify, right? So next question, which cusps are considered the functional cusps in a normal occlusion for posterior tooth, right? For posterior teeth. So we have to identify the supporting cusps. So as I was just talking about the supporting and guiding cusps, so in posteriors there are some cusps which will be supporting, some cusps which will be guiding. So let's say this is the image of two occluding molars. Let's say upper one is maxillary, this is mandibular. Obviously, this is the buccal side, this is the lingual side. Now, as you can see, upper buccal and lower lingual are guiding, and upper lingual, lower buccal are the supporting cusps. So, just identify the option which says upper lingual, lower buccal. So, maxillary lingual and mandibular buccal, these cusps are the supporting cusps. So, they can also be called the holding cusps, isn't it? Holding or centric holding cusps, since they support the occlusion, and during the excursive movements, these guiding cusps, they will help in the positioning of mandible. So that's why they are called the guiding cusps. So option B is the correct answer. Next, a 7-year-old child presents with an enlarged double upper incisor. So there is an enlarged double upper incisor. Its width appears exceptionally large, whereas the adjacent tooth is smaller in comparison, right? but the total count of teeth in that arch is normal for their age. This dental anomaly is most likely. So this is a question which takes some support from dental anatomy but is mainly from oral pathology. So how would you differentiate whether it is fusion, gemination, concrescence or densive vaginatus? So obviously it is not densive vaginatus, isn't it? It's not densive vaginatus. This is wrong. But apart from this, of the three, fusion, gemination, concrescence, which one of these do you think is the correct answer? Yes, very good. Because the number of teeth, the count of teeth, that is the number of teeth, that is normal for the age, right? So number of teeth is normal, and yet this tooth appears enlarged, right? This tooth appears enlarged, which means it has undergone division, right? It has undergone division. So that's where division or twinning, isn't it? Division or twinning. Yes, very good. So option B, it is gemination. So let's go to the next question. So these questions now are from dental histology. In a ground transverse section, right? So let's say this is a tooth. So in a ground transverse section, if of a tooth, you observe concentric dark lines in the enamel extending from DEJ towards the enamel surface. What do these lines represent? So let's say this is the pulp, then this is the dentin, and then this is the enamel, and in the enamel you have concentric lines, right? In the enamel you have the concentric lines. So what do these lines represent? Options are Hunter-Shaker bands, striae of Regius, perigameta and enamel lamellae. So what do you think is the correct answer? Is it Hunter-Shaker's band? Is it striae of Regius? Is it perigameta or is it enamel lamellae? So obviously the correct answer here would be, yes, very good, striae of Regius, right? Striae of Regius. So these are weakly incremental lines, isn't it? These are weakly incremental lines. So in the transverse section they will appear concentric, in longitudinal section they will appear running obliquely, isn't it? They will appear running obliquely from DJ to outer surface, and its external manifestation is perigameta, isn't it? What is perigameta? Perigameta is the external manifestation of striae of Regius, right? And enamel lamellae, these are developmental defects, isn't it? So they'll be running vertically from DJ towards the surface, right? So which of the two statements is correct regarding enamel lamellae? So this is the first statement, that they form from DJ to surface, and the second statement is that they are seen running from surface to DJ. So which of these two statements about enamel lamellae is correct? Which of these two do you think is correct? Is it option A? Is it option B? They form from DJ to surface, or they are seen running from surface to DJ? तो भावना कह रही है कि ऑप्शन ए करेक्ट है. What about other students? Kapil or Neha, Nikesh. So Nikesh says it's second, Bhavna says it's 1. So overall we can say some of you would say 1, some of you would say 2. So what I would do is, I would say that both of these are correct, right? Both of these are correct. So what would you say then? तो मैं कह रहा हूं कि ये दोनों ही सही हैं. अब तुम क्या कहोगे? नहीं. The thing is, because you have focused only on the direction. See, you have focused only on the direction. You have focused on the partial statement. You haven't read these statements completely, because these two statements are different here in their first half, right? They are forming in the direction. The first statement is talking about its formation, so it forms from DJ to surface, and the second statement is talking about its observation. How do we observe it? So from our point of view, so obviously we are observing from its outer surface, isn't it? We are observing the tooth from outside. So we'll observe it from surface towards DEJ. That's what the second statement says, that it is seen running from the surface towards DEJ. But what the first statement says is that it forms from DEJ to surface. So yes, that's the direction of formation. As I just said, that enamel lamella is a developmental defect, isn't it? So obviously type 3 or the type C, that is a crack, and that might form from surface to DEJ, but then again that is not a true enamel lamella, that is a false enamel lamella. So a true enamel lamella would always form from DEJ to surface, and we will look at it from surface towards DEJ. So both these statements are correct. तो ये जो लास्ट वाला है ये कंफ्यूजन करने के लिए, क्रिएट करने के लिए है, बट ये जो फर्स्ट हाफ है दिस इज वेयर यू शुड फोकस, ठीक है ना, कि ये बन कहां से रहा है, तो बन तो रहा है डीजे सरफेस, और हम कहां से देख रहे हैं, हम उसे सरफेस से डीजे की तरफ देख रहे हैं. सो बोथ ऑफ दीज स्टेटमेंट्स आर करेक्ट, राइट. The following enamel structures is formed by the entrapment of odontoblastic process at dentin enamel junction. So I think this is relatively easy. वैसे तो आपने सारे क्वेश्चन सही आंसर किए हैं और ये बहुत ही अच्छी बात है, सब पढ़ रहे हो, वेरी गुड. तो in which of these forms by the entrapment of odontoblastic process in enamel? Is it enamel tuft? Is it spindle? Is it rod? Or is it lamellae? So the correct answer would be which of these forms by entrapment of enamel, by entrapment of odontoblastic process. The correct answer here would be enamel spindle, isn't it? Enamel spindle forms from the entrapment of yes, sure. पहले एक बार ये कर ले निकेश, है ना, इसका आंसर कर लेते हैं एक बार और उसके बाद फिर हम वो देख लेते हैं. So enamel tufts, these are couple enamel tufts, these are grass-like defects or fan-shaped defects. So these are grass-like or fan-shaped hypomineralized defects which are seen at DEJ, isn't it? Basically, they are rich in tuftlin, isn't it? So enamel tuft is not the correct answer. Enamel spindles, that is option B, is the correct answer. Right? So option B, that's enamel spindle, is the correct answer. That is formed by entrapment of odontoblastic process. Enamel tuft and enamel lamella, these are both hypomineralized. These are both hypomineralized structures of the enamel, as is enamel spindle. But enamel spindle is the only hypomineralized structure which is of ectomesenchymal origin, isn't it? Because it is derived from odontoblastic process. This is the only ectomesenchymal structure, as it is derived from odontoblasts, right? Now, the types of enamel lamellae. So basically, there are three types: type A, type B, and type C, isn't it? Type A, type B, and type C. So basically, just imagine that enamel lamella represents a space where there should have been an enamel rod, but that enamel rod is either hypomineralized or it is missing, right? That is what enamel lamellae represents. So what is type A? Type A basically represents a hypomineralized or demineralized enamel rod, right? So basically it's developmental, so we will use the term hypomineralized and not demineralized, because demineralized says that we have applied acid to it, and because of that acid application the enamel rod has undergone demineralization, right? So in that case it won't be a defect, right? So it would be a defect when it is hypomineralized. So there is a hypomineralized enamel rod in type A. So where has been a defect? Defect कहाँ किस level पे था? Enamel के formation में, isn't it? During the secretory stage or during the maturation stage? In which stage was the defect in type A? So the defect was in the maturation stage probably, and that's why it did not get completely calcified. So the defect was in maturation stage, isn't it? So what do we see in type B? In type B, we will see a degenerated ameloblast. Right? In type B, we will see a degenerated ameloblast or degenerated formative cells, isn't it? Or we can say a degenerated enamel organ, क्योंकि enamel organ का important part जो कि enamel बना रहा है, that is ameloblast. So if ameloblast is degenerated, we can say it is either degenerated ameloblast or degenerated formative cells or degenerated enamel organ, right? So again, the defect will be in the secretory stage because the enamel has not been secreted. Is it clear? तो यहां पर क्या हुआ सेकंड में? Hypoplasia कह सकते हो, isn't it? You can call it hypoplasia because the enamel has not formed. So when the enamel has not formed, it definitely did not mineralize. So there is a defect of enamel formation. Now let's say the defect started in the pre-ameloblast stage. Maybe the pre-ameloblast was defective. So if the pre-ameloblast was defective, then definitely the odontoblast in that region did not form because pre-ameloblast secretes factors, isn't it? So if pre-ameloblast is defective, odontoblast will also be defective. So this defect might continue beyond DEJ into dentin, isn't it? And if the defect appeared after the pre-ameloblast stage, that is in the ameloblast stage, then the odontoblast was differentiated properly, but the ameloblast was defective. So this defect might be limited in enamel. So a type B lamellin may or may not cross DEJ. Is it clear? Whereas type C is a crack, and a crack would be filled with debris. Isn't it? Organic debris would be seen in the crack, and it may or may not extend into dentin again, just like type B may or may not extend into dentin. But since type A is an unmineralized enamel rod, it would definitely be restricted to only enamel. Is it clear? So obviously, which of these will be formed before eruption and which will form after eruption? A crack would definitely form after eruption when the tooth is in function, isn't it? So it forms after eruption. Whereas type A and B, since they are developmental defects, they will be formed before birth, isn't it? They will be formed before birth. But for an example, in the rare case, say for example, we are talking about the demineralized enamel rod. So demineralized enamel rod might form after birth. But usually, what we will consider is that hypomineralized, that is type A and type B, will be formed before birth. Is it okay? Is it clear? I think Nikesh asked about these different enamel lamellae. Is it clear? So type A and type B are developmental, whereas type C, that is a crack and it forms after eruption. So it's a false lamellae. Type A and type B are developmental, right? And they are the true lamellae. So let's go to the next question. Transparent dentin is often seen in older teeth or beneath slowly progressing caries. So how does sclerotic dentin typically appear when viewed under reflected light in a ground section? So what it is asking is, there is sclerotic dentin and we are viewing it under reflected light. So you might see it under, or you might observe it under reflected light, or you might observe it under, what is the other light? One is reflected and one is incident, isn't it? That is coming through the tissue. So here's the tissue and we are standing here. This is the observer. So the light is being reflected and you are observing it. So how will it appear? Dark, light, reddish, translucent. Now since this is translucent, it will pass through the tissue and you will not see anything, right? This is like a glass. So it will appear dark, isn't it? Whereas if the light was coming through the tissue, let's say this is the observer and the light is coming through the tissue, that is transmitted light or incident light, then what will happen? Since this is glass light, the light will pass through the tissue and you will be able to observe it. Opposite will be seen in case of dead tract, because dead tracts, they are opaque, isn't it? Dead tracts are opaque. So let's say this is the observer and if it is a dead tract, then the incident light or the transmitted light will be reflected away, whereas the reflected light will be visible to the observer, right? So their appearance will be opposing. In the reflected light, sclerotic dentin appears dark, whereas dead tracts appear light. So here the correct answer is dark. Black and reflected, yes. Dentinal sensitivity can cause sharp pain when exposed to dentin, dentin is stimulated. Which theory of dentin hypersensitivity is most widely accepted for explaining this pain? So, which is the most widely accepted theory? So, there are three theories, right? Direct neural innervation, odontoblastic transduction theory, or simply transduction theory. Third is hydrodynamic theory. So, which of these three do you think is the most widely accepted? Now, since we had to include some option, I have included any of the above, right? So, which of these three is the most widely accepted theory? It is the hydrodynamic theory, right? It is the hydrodynamic theory. नेहा ज्यादा जल्दी जवाब दे दिया है ना, तो टेक योर टाइम एंड आंसर. So, what happens in hydrodynamic theory? So, this is the nerve, right? And we have like this dentinal fluid and the pulpal fluid, right, surrounding this nerve. So, whenever a stimulus is applied, it will either cause outward flow or inward flow of the dentinal fluid, which will stimulate this nerve, and then pain will be perceived, isn't it? So, have I told you which of these movements is more painful? Is it the outward flow or the inward flow? So, which amongst these two is more painful? So, the outward flow of this dentinal fluid or the inward flow of this dentinal fluid, which is more painful? Which is more painful? Is it the outward flow or is it the inward flow? Which is more painful? So, option A is outward, option B is inward. So, which of these two is more painful? Is it the outward or the inward? Yes, Bhavna. Very good. Outward flow is more painful. Isn't it? Outward flow is more painful. So, if sometimes you are confused, just remember that air rotor without air water, yes, remember that air rotor without aerosol, without coolant is more painful as compared to air rotor with coolant, isn't it? So, without coolant, it will evaporate the dentinal fluid, and that's why the fluid movement is towards outside. So, it is extremely painful, isn't it? So, next question. The neonatal line is an accentuated incremental line in dental tissues formed at time of birth. In which tissue can a neonatal line be observed? So, where is this neonatal line observed? That's the simple question. Hai? Options are enamel of all permanent teeth only, enamel and dentin of primary teeth, dentin of permanent teeth, and cementum of all teeth. So, which would be the correct answer here? कौन सा correct option है इनमें से? Which option amongst these is correct? Enamel of all permanent teeth only, enamel and dentin of primary teeth, dentin of permanent teeth, yes, cementum of all teeth. So, where is the neonatal line seen? So, what is neonatal line? Basically, neonatal line differentiates between prenatal and postnatal tissue, isn't it? Prenatal and postnatal tissue. So, where will it be seen? It will be seen in the teeth that are partially formed before birth and are completed after birth, isn't it? So, obviously, it will be seen in primary, isn't it? It will be seen in all the primary teeth. So, can you tell me which permanent tooth will also show this neonatal line? Which permanent tooth will also show this neonatal line? So, apart from all primaries, first, permanent molars, they will also show neonatal line, isn't it? They start calcifying at birth, so they will also show this neonatal line. Yes, very good, Bhavna. So, in a fully developed tooth, the coronal pulp exhibits a well-defined histologic zones. So, there are different zones in the pulp, isn't it? Immediately deep to the odontoblastic layer is an area containing a rich network of nerve fibers and capillaries, but a few cells, or you can say no cells, right? The cell-free zone. What is the name of the nerve plexus located in this region of the pulp? That is rare case, isn't it? It's a rare case. Lower central incisor. At what time does it initiate? It initiates at about 3 to 4 months of age. So obviously it initiates after birth, isn't it? So lower central incisor तब है कि हमें कुछ भी और समझ में नहीं आ रहा है, कोई भी और ऑप्शन, मतलब as I have told you several times, solving an MCQ is not about finding the correct option. It is always about finding the best option. So sometimes what will happen is all the 4 options are incorrect. At that time, lower central incisor might be the least incorrect option. Okay? So then you can go with the lower central incisor. But any tooth that initiates after birth cannot show neonatal line. Right? तो अब आपके पास ऑप्शन ही ऐसे हो गए कि अपर 7 है, upper 2 है, right? Let's say then you have lower 1 and then you have lower 3, and then you ask which of these teeth will show neonatal line. Then obviously all of these are highly incorrect, and this is the one which will initiate the earliest, isn't it? Lower 3 will also initiate at an age of about 4 to 5 months. 2 initiates at an age of around 11 to 12 months, and 7 will initiate at about 2.5 to 3 years, right? So obviously in that case, lower one which initiates the earliest, that would be your correct answer. But that would be your correct option, not the correct answer. Obviously, none of these is correct, but this is the best, right? So the answer of this question would be plexus of Rashko, nerve plexus of Rashko, cell-free zone of Weil. So this zone is called cell-free zone of Weil, and the plexus is called the nerve plexus of Rashko, right? And what are the 4 zones? These 4 zones are odontoblastic zone, from outside to inside, isn't it? Odontoblastic. After odontoblastic, we have cell-free, then we have cell-rich, and then the core, isn't it? So nerve plexus of Rashko is found in the cell-free zone. So would it be okay if I said that cell-free zone or the nerve plexus of Rashko forms adjacent to cell-rich zone? Would it be okay if I said that plexus forms adjacent to cell-rich zone? Would it be okay to say that nerve plexus of Rashko forms adjacent to cell-rich zone? That would be correct, isn't it? Because cell-free zone is adjacent to cell-rich zone, right? So let's go to next question. Which of the following correctly describes the distribution of acellular versus cellular cementum on a single rooted tooth? Right? Options are cellular cementum predominates on the cervical half of the root, while acellular cementum is apical. Next is acellular cementum predominates on the cervical half, while cellular cementum is more apical. Option C, both acellular and cellular cementum are evenly distributed throughout the root. And option D is acellular cementum is found only in furcation areas of multi-rooted teeth. So which of these do you think is the correct answer? Yes, very good. Option B, that is acellular cementum predominates on the cervical half of the root, while cellular cementum is more apical. Now let's say I included one more option, and I said that acellular is more common on the cervical third and cellular is on the apical 2/3. Along with these 4 options, I had one more option. Option E, that says acellular cementum is more predominantly found on cervical third and cellular on the apical 2/3. Now, which would you mark as the correct answer? So with this additional option, what would you choose now? What would you choose now? So Priti says she would still go with option B. Neha would still go with option B. Very good. Option B is still correct. Why? because this is the key information, right? That we are talking about a single rooted tooth. We are talking about a single rooted tooth. Had it been about a multi-rooted tooth, about a posterior tooth, then the option would have changed to option E, because option E is correct for posteriors, right? It is correct for posteriors, specifically molars, right? तो E हम कब चूज करते हैं? जब हमें मल्टी रूटेड टूथ के बारे में पूछा जाता है, हमें मोलर्स के बारे में पूछा जाता है, then would have chosen option E. Since this question is asking about a single rooted tooth, we would still stick with option B. Is it clear? So let's go to the next question. A histological section of a salivary gland shows predominantly mucus acini. Which clusters of with clusters of crescent-shaped serous cells capping the mucus units, that is serous gemmules. So serous gemmules are seen, mucus acini is seen. Which salivary gland is the most likely to be? Option A, parotid gland, submandibular gland, sublingual gland, or von Ebner's gland. So which of these four do you think is the correct option? So we are looking at the histological section of a salivary gland, and we see that there are mucus acini with clusters of crescent-shaped serous cells capping the mucus units, right? तो crescent-shaped serous gemmules भी हैं, और कृति कह रही है कि it has to be submandibular gland. So बाकी बच्चे क्या कह रहे हैं? Very good. So everyone agrees that it should be submandibular gland. Now, why do you all say that it has to be submandibular gland? Why do you all think that it is submandibular gland? Why do you all think that it is submandibular gland? There are three major glands, isn't it? Parotid, submandibular, sublingual. Anjali is smart one, right? She has taken her time and she has thought about it and then she has answered. So we have three glands, isn't it? Major glands: parotid, which is the largest, then submandibular, smaller than parotid, and sublingual, which is the smallest major salivary gland. And what have we studied in class? That parotid is purely serous, submandibular is mixed serous, sublingual is mixed mucus. So amongst these three, where will you see mucus acini predominantly? So which of these three will show predominantly mucus acini? Obviously, submandibular gland is predominantly serous. It has mucus, but it is predominantly serous. Sublingual gland is predominantly mucus, isn't it? So predominantly mucus acini कहाँ दिखेंगे हमें? Sublingual में या submandibular में? The answer would be sublingual gland, right? So this is the key information. Predominantly mucus acini. Is it clear? Now, von Ebner's gland, this is a minor salivary gland associated with circumvallate papillae, and yet it is the pure serous gland. This is the only minor salivary gland which is serous. Rest all the minor salivary glands are mucus, isn't it? Is it clear now? Why have you chosen sublingual gland and why you should take your time while answering the question? तो यूजुअली क्या होता है, एमसीक्यूज डिफिकल्ट नहीं होते, हम उन्हें डिफिकल्ट बना देते हैं, है ना? द इनिशियल अटैचमेंट एपिथेलियम दैट फॉर्म्स अराउंड द सर्वाइकल पोर्शन ऑफ द टूथ इज derived from. So where is the initial attachment epithelium derived from? That is the simple question. Option A, oral mucosal epithelium. Option B is dental papilla. Option C is reduced enamel epithelium, and option D is dental follicle. So which of these four do you think is the correct answer? So which is the correct answer? Initial attachment epithelium that forms around the cervical portion of the tooth is derived from oral mucosa, reduced enamel epithelium, dental papilla, dental sac. क्या आंसर होगा इसका? Yes. In this question, all of you are correct. It is the reduced enamel epithelium, because when the tooth erupts, the reduced enamel epithelium, it fuses with the oral mucosa, isn't it? The reduced enamel epithelium, let's say this is the tooth, isn't it? This is the tooth, and this is the reduced enamel epithelium, and this is the overlying oral mucosa. So when the tooth is erupting, these will fuse, right? It will fuse like this, right? And then a break will form here. And a break will form here, right? And that's how the first attachment epithelium or the junctional epithelium is formed. It is formed by the reduced enamel epithelium, right? And when it first turns over, then the cells will be derived from the oral mucosal epithelium. So let's go to the last question. Unlike most synovial joints in the body, the articulating bony surface of the temporomandibular joint are covered by which type of tissue? So in most of the synovial joints, the articulating surface is covered by hyaline cartilage, but not in TMJ. In TMJ, the articulating surfaces, that is the condylar surface or the glenoid fossa, they are covered by which cartilage? Option A is hyaline cartilage, option B is elastic cartilage, option C is fibrocartilage, option D is dense fibrous connective tissue without cartilage. So the correct answer here would be option C, that is fibrocartilage, isn't it? Fibrocartilage lines the condyle, and it is the fibrocartilage that is responsible for remodeling of condyle even at a later age, right? It is the fibrocartilage that is responsible for remodeling of the condyle even at a later age. So if I asked you which zone of fibrocartilage is responsible for remodeling, it has 4 zones, isn't it? Outermost fibrous, then proliferative zone, then zone of hypertrophy, and then the deepest zone, which is the zone of calcification. So which amongst these 4 zones is responsible for this later remodeling? It is the zone of hypertrophy, right? It is responsible for remodeling. Why? Because in the zone of hypertrophy, we have undifferentiated cells, right? Is it clear? Not the 4th zone xenia, it is the 3rd zone, right? It is the zone of hypertrophy, which is responsible for remodeling. And the remodeling is because of the undifferentiated cells, right? So is there anything else that you would like to ask? क्योंकि हमारे यहाँ पर complete हो चुका है ये, and I guess pedo faculty might be waiting. So if you have anything to ask, let's do it quickly. Otherwise, you can continue with the pedo class. So are we done? So okay students, all the best, and remember the key thing, always choose the best option. Don't go hunting for the correct answer. Sometimes you might not have the correct answer. तो जो भी ऑप्शंस उनको ढंग से पढ़ो, देखो इनमें से कौन सा सबसे अच्छा है, and that will be your correct answer, right? All the best.